February is Heart Month, so for today's Healthy Living, I have naturopathic Dr. Jacqui Fleury with me to talk all about heart health. Good morning.
Good morning.
So when it comes to menopause, how does this impact heart health?
During menopause, our estrogen levels drop, and that can contribute to our vessels, for example, being a little less flexible. So we start to notice changes in the way our heart functions, and also in the way the vessels that carry blood to and away from the heart are affected.
And I was curious, you have these supplements with you and tests. I was wondering what kind of tests people can do and what should they be looking out for?
Well, I think that what I really wanted to focus on is the fact that when we hit menopause, definitely our estrogen levels are going to drop. And often that will amplify some of these underlying health deficiencies or imbalances that may have existed for women for years. And so although the emphasis is trying to restore women's estrogen levels, that can be very important and very helpful from a cardiovascular perspective. But there are underlying factors that can also be contributing to our circulation and our brain and our vessels not being as healthy as they could be. So do you like me to talk a little bit about some of these tests?
Yes, I would love that.
So the first thing is knowing your omega-6 to 3 ratio, because if we don't have enough omega-3s in our vessels, in our cells, then our cells become less flexible, and that translates to perhaps less flexibility and fluidity in our circulatory system. So there's a test that you can do that tells you what are those ratios, and then we want to correct that ratio because that helps move us to basically a less inflamed state at the level of our cells. So that's one test that we can perform.
And so is this something you should start considering when you're over 40, or what kind of age range should you be thinking about this?
Well, I think it's applicable to women at any age, any menstruating woman for sure. It sort of prepares you as you come into perimenopause and menopause. But simple things like knowing your vitamin D status, so we've talked about that before, understanding whether or not you have food sensitivities, because that will trigger a low-grade inflammatory response. And then also understanding that your gut is intimately connected to the health of your heart as well. So making sure that there isn't inflammation or, as I like to say, a weedy garden, because microbes in our gut can affect the health of our heart as well.
And so what are some of those simple shifts, things to keep in mind to keep your heart healthy?
That's such a good question, and really there are simple strategies, like I talked about the vitamin D, making sure you know your levels, and then correcting a vitamin D deficiency or sometimes an excess with supplements like vitamin K, which keeps the calcium out of the vessels, and vitamin D. So vitamin K and D work intimately together. Knowing your homocysteine and your fasting insulin levels can be really important. And then compensating with B vitamins, a good quality B vitamin. Understanding that the health of your gut is connected to the health of your heart. So high quality probiotic, and then making sure that we're weeding and fertilizing the garden, as I like to say. So those are all really practical strategies that work towards overall heart and cardiovascular health in perimenopause and menopause.
And is there anything else you would like people to know about heart health?
The heart is part of your overall health and well-being, and so yes, during menopause it becomes more of an issue. I mean, heart disease is the #1 killer for women postmenopausal, but understanding that there is more to this conversation, and there's more that we can be doing to support the health of your circulation and the health of your heart, that really starts at that root cause approach.
Well, this was some really great information and advice, and thank you so much for taking the time today.
Thanks for having me.